Welcome back to DrShoCares. We're here in 2024 and starting with an interesting topic, although maybe quite relevant from following the holiday season, where people have more intercourse and therefore are at higher risk of getting sexually transmitted infections. This is something that impacts all ages, and I think it's really important that we have this conversation. So let's dive in. So, what are sexually transmitted infections? So they're infections that can spread through sexual contact, and this can happen during vaginal, anal, oral sex or skin to skin contact. And viruses, bacteria, and parasites cause these infections. Now, what are the common types of STIs and their treatments? Now, there are many different types of STIs, and they're the common ones that people will know about, such as HIV, gonorrhea, chlamydia, herpes, and genital warts caused by the HPV virus. So that's the human papilloma virus. Now, you may know that this is also the same virus that is implicated in cervical cancer, but the subtypes of the virus that cause genital warts and that cause cervical cancer are different. And in this talk, we're talking about the ones that cause genital warts. There's also the herpes simplex virus, and that can cause soreness around the vagina or the uh, the the genital organs. There is trichomoniasis, there is lymphogranuloma venereum, and there's syphilis. Now, syphilis has made a comeback because it was almost eradicated, but it's made a comeback in the last few years, and it's definitely very much on our radar in terms of the conditions that women can get. Now, most STIs are curable with antibiotics or antivirals, or the body clears them. So things like herpes and HPV can be latent in the body, so they might be still present but not cause any symptoms. So often it can be very difficult to know at what point did the person contract them, and in fact they're carried by a huge percentage of the sexually active population. So basically, it's kind of a fool's errand looking for where did I get herpes from, or where did I get genital warts from. And basically, a lot of the time the body's own defenses will clear or treat those infections itself. But sometimes, particularly for herpes simplex, people might need antivirals to help with the symptoms, particularly if they're getting recurrent flares, and some people might even be on the medication for long term. Now, HIV an infection that is very, very treatable. So it's not at the moment curable, but it's treatable with antiretroviral medication. And in fact, people have a life expectancy as normal on antiretroviral medication. That's not to say that some of the medications don't have side effects, but they're generally much better than the first generation of medications that were on the market. And at the moment, we know that these treatments are very effective. Now, hepatitis B and hepatitis C are quite interesting because, again, with hepatitis B and C, the body can clear it, but some people get a chronic infection, and that then needs to be managed by specialists, because it can cause problems with the liver, and in fact can lead to liver failure or liver cancer if not treated properly. Now, regular testing, awareness, and open communication are really important in making sure that we maintain sexual health. Now, why should we worry about sexual transmitted infections? Well, as a woman, you have to have knowledge so that you can protect yourself from these sexually transmitted infections, because particularly for the gonorrheas, chlamydias, and syphilis, and all the ones that can be treated with antibiotics, if left untreated, they can cause problems with risks of infertility in the future, something called pelvic inflammatory disease that can cause discomfort and also infertility. Obviously, we talked about HPV virus can impact increased risk of cervical cancer, although, as I said, is a different subtype than the one that causes genital warts. There's other long-term health complications of things like HIV and hepatitis, as I've spoken about, and and you know, people can actually die from untreated sexually transmitted infections. So it's really important that you get tested regularly, particularly if you have casual relationships. And I advise that if you're not in a long-term relationship and you're sexually active, that you should try and get a sexual health check every 3 to 6 months, or after every change in partner. So if you've had a short-term relationship, and then after the change in partner, that you could um, have a sexual health screen. So it's important that you look after your sexual health. Now, how do sexually transmitted infections spread? So they're mostly spread through fluids in the body. So the fluids that are shared during vaginal, oral, and anal sex. But they can also be spread through contaminated blood. And that's why infected drug needles can spread bloodborne infections such as HIV, hepatitis, and then from mother to child during pregnancy, this is one of the routes in which infection can be passed. So it's important to know if a patient is pregnant and has an STI, so that we can try and work on that break in transmission, so that it's not passed on to the child, or give the child adequate treatment when they are born. Um, so it can pass during pregnancy or childbirth, or even whilst breastfeeding. And so it's really important that that's flagged up, and that's why most pregnant women here in the UK are tested. And I think it's a standard of care that pregnant women are tested for sexually transmitted infections and bloodborne viruses. Okay, now who is at risk of sexually transmitted infection? So it can impact anyone, but certain groups of women are more susceptible. That's women with multiple sexual partners. So the older a woman is, the more fragile her vagina can be, because of the effect of depleted estrogen, and that can increase the risk. There's also women who have no awareness and are vulnerable. And then there's not using practicing safe sex, so not using condoms, having other risk factors like illicit drug use, not being vaccinated for the HPV vaccine, because in a lot of countries the HPV vaccine covers all the different types of that of HPV that we know are commonly causing both the genital warts and cervical cancer. Some countries only give the ones that cause cervical cancer, but you can get the vaccines that cover the genital warts as well, and that can help prevent that. Then, of course, there's always economic disparity. So a lot of the people that are more disadvantaged are higher risk of getting sexually transmitted infection, but they're also at higher risk of basically being having sexual violence and all of those things, and that can impact getting sexually transmitted infection. Now, if someone has had a previous sexually transmitted infection, then that just flags up that we need to be thinking about their risk is higher. And then unprotected anal sex can be very, very high risk, because the anal canal is more fragile and more friable, so that then can increase the risk of sexually transmitted infections. Now, we talk about STIs in menopause because, as I mentioned, getting older means that our immune systems may not work as well. And this is getting older biologically, because a lot of people with a good lifestyle can actually age slower biologically than they're aging chronologically. So this can make it harder to combat infections and diseases. Now, menopause can be a very fabulous time in a woman's life to reawaken her sexual experiences, and that's something that we greatly encourage here at DrShoCares. And also, having vaginal lubricants can really increase enjoyment, and the fact that they know that there's not risk of pregnancy, all of those sorts of things can really make it a special time in a woman's life. However, that also means that they can be a slight higher risk because of declining estrogen levels, increasing the vulnerability of the vaginal tissues to tears. So that's really important to make sure that you practice safe sex in the menopause. So older people also get sexually transmitted infections, and because it may not be immediately manifesting, so you might not get immediate symptoms, then it's important to get checked. Now, what are the common symptoms? So just mentioned that symptoms might not always be apparent. And so asymptomatic screening, so going for regular checks, as I mentioned previously, is really important. But then if you have any of these symptoms, so abnormal vaginal discharge, changes in urination pattern, so pain on it passing urine or discomfort with urination, now that could be a urine infection, but it's also important to think about, could it be a sexually transmitted infection? Itching in the vaginal area, pain during intercourse, abnormal vaginal bleeding, rashes, or sores that weren't there before. Um, Now, what are the long-term complications of STI? So we already talked about pelvic inflammatory disease, and that can result in not just discomfort and can be very uncomfortable for a woman, but actually can increase her risk of infertility in the future. And then if women have STIs during pregnancy, it can increase their risk of complications. STIs can increase vulnerability to other infections. And then there's often an impact on the mental health, like when people are diagnosed with an STI, because they often feel, oh, I can't believe this happened to me. But actually, they're very, very common. And we would encourage people not, to seek for help if it's impacting their mental health, and they might need some counseling or support through that. Now, what can you do about STI? So very important, talk to healthcare professionals, so doctors, nurses, pharmacists. There's a lot of information out there. There's ways in which you can access self-screening even at home or in your own environment, but also there are loads of sexual health clinics that you can go to get tested. Now, it's really important to use protection, so using condoms when engaging in sexual intercourse, particularly with casual partners, and open communication with partners to let them know about your needs, and making sure that about what they're getting up to, so that you feel confident in your sexual relationship, and have the vaccination when offered, and as I said, test. You should be on the lookout for these things, because as I say, a lot of the time it doesn't show up. Now, can we break the stigma surrounding STIs? Yes, we can, because we need to move away from judging. Instead, let's talk openly about prevention, understanding, and supporting one another. Anyone can be affected, and seeking medical help should be fear free. So we are at DrShoCares really encouraging people to talk about sexually transmitted infections and seek help as needed. So let's remember that staying informed, getting regular checkups, and talking about sexual health is really important. By taking these steps, we not only protect ourselves, but also contribute to building a community that values the health and well-being of everyone. So thank you for listening. I'm Dr. Sho, and I'll see you next time on DrShoCares.